What about 300, madam? Can we exit? That is quantum cryptography.
Yes, sir. Yes.
Oh, thank you.
So I hope I'm audible.
Yes, sir. Yes, sir. Continue.
Okay. Thank you so much, sir. So first of all, a very good afternoon to chair of the session and other members present here. So I am Dr. Rizwan Alam, here to present our research paper titled TumorGAN-TL, Enhancing Brain Tumor Detection with DCGAN-Generated MRI Images and Transfer Learning Models at CODE-AI 2025. So my co-author is Mr. Pulkit Porwal, and we both are associated with Amity Institute of Information Technology, Amity University, Rajasthan. So let's start with the outline of this presentation. So of introduction, then related work, then the methodology that we used in this research paper, and then we will present results and findings, and finally we will conclude, and last but not the least, the references that we used for this research paper. So let's start with introduction. As we all know that the number of brain tumor cases has significantly increased, especially in Asian countries and especially in India. So brain tumors are currently the 10th most prevalent type of tumor among especially children and adults. So the correct classification of brain tumors is imperative for appropriate medical treatment, which can lead to improved survival rate for patients. And for diagnosing this brain tumor, MRI, that is magnetic resonance imaging, is the preferred clinical tool that is used to identify brain tumors, but the quality and reliability of human diagnosis majorly depends on access to large and annotated data sets whenever we want to use some deep learning or AI models for making it automatic classification for brain tumors. So the scarcity of annotated MRI images is one of the most significant challenges to the development of reliable automated deep learning models to identify brain tumors. So the objectives that we try to achieve through this research work is to generate synthetic brain tumor MRI images via deep convolutional generative adversarial networks known as DCGANs to augment the current training data set, and to employ transfer learning models to classify MRI images into tumor and no tumor categories. So it was that we used those synthetic images, synthetically generated MRI images, and after that we applied transfer learning models for binary classification at this stage. So, and to evaluate the benefit of DCGAN generated synthetic images have in improving the performance of transfer learning models or not, especially for brain tumor detection. So the research questions that we explored in this work are: can DCGAN generate quality synthetic MRI images to especially improve the variation of training data set for brain tumor detection? And the secondly, that which transfer learning model has the highest model accuracy when trained on data set that include not only real images, even the synthetic images that we generated from DCGAN? And how is the performance of the proposed TumorGAN-TL framework that we proposed in this research paper, comparing it to traditional methods where these methods use only real MRI data sets? So the main contributions that we claim through this research work is that novel framework or the proposed framework, that is TumorGAN-TL, to integrating synthetic MRI images with transfer learning model for brain tumor classification, developing a DCGAN based approach to generate high quality synthetic MRI images, and after that fine tuning the pre-trained CNN models, transfer learning models like ResNet, EfficientNet and MobileNet by modifying their especially output layers and other architectures in their model for brain tumor classification, and to conducting a comprehensive analysis of different CNN architectures to evaluate their effectiveness in classifying tumors, especially using synthetic data. So we have, for related work or literature review, we have gone through a number of research papers, and here we have presented in the form of a table only the relevant and selected research papers that were mainly using some GAN models for generating brain tumor data sets and using some transfer learning models. So we have reviewed a number of research papers. And then after going through that, we found that there is a research gap, like after existing literature that we have reviewed highlighted the significance of GAN-based data augmentation and transfer learning models for classification. But in most of the papers or the studies that we have reviewed, actually they focused on synthetic data generation separately and classification separately. So without a unified framework that integrates both effectively, so that's why we propose this framework where actually to address the limitation of annotated data set, and then applying these using these generated data sets, synthetic images data set for brain tumor classification using transfer learning. So next we come to the methodology, for which I would like to request co-author Mr. Pulkit to present for these slides.
Thank you, sir. So I'm going to continue from the methodology. And for our study, we use a data set that is publicly available on the Kaggle, which consists of 253 images in JPG format, and out of those images, 155 images classified as tumor images, and remaining are non-tumor images. And here are some samples of those images in Figure 1 and Figure 2. Now our main framework comes into the picture, that is TumorGAN-TL framework. So the framework that we propose is divided into two main components. First is the generation of MRI tumor images using DCGAN, and then the classification using multiple transfer learning models. As shown in the Figure 3, we tried to explain the whole flow diagram of our framework. That is, first we'll try to generate the images through GANs, then we'll use those synthetic images to train our transfer learning models, and then we'll test out the real images on the transfer learning models and check their accuracy, whether they are predicting it correct or not.
Sir, timer. Sir, you can show your results.
Okay, ma'am.
You can show your results.
Okay, ma'am. So I'll directly come to the results. So for the image generation evaluation, we use three metrics, that is SSIM score, PSNR value, and density distribution plot. So the SSIM score, that is structural similarity index measure, is 0.86 for our images. That indicates high perceptual similarity and effective preservation of tumor structures when compared to real MRI scans. And for the PSNR, we are achieving 36 decibel value. That shows the synthetic MRI images are of high quality with minimal distortion. And lastly, the density distribution. The intensity of density distribution of synthetic MRI images closely aligned with the real ones, validating that the DCGAN effectively captures the replicate the underlying pattern present in the actual brain tumor scans. And Figure 7 illustrate that the distribution of synthetic and real MRI scans closely align, validating the effectiveness of our model. And this is also the answer of our research question 1. And for the transfer learning model, we used most used matrices like accuracy, precision, and recall, and F1 score. And the table 1 represents a comparative analysis of classification performance across three widely used transfer learning models, that is ResNet, EfficientNet, and MobileNet. And among the three models, ResNet demonstrated the highest performance with an accuracy of 97.51%, along with the precision of 97.32%, recall of 97.69%, and F1 score of 97.17%. And from the comparison with the previous studies, Table 2 depicts a comparative analysis of our model accuracy against previous studies, while our model achieves an accuracy of 97.51%, slightly lower than the other reported models. A key distinction lies in the dataset.
Sir, you can wind up. Sir.
Okay, ma'am. Thank you.
Sir, one thing I need to ask, what is the ratio of real images and GAN-generated images that you have used for the training?
Yes, sir. So can you repeat, please?
Sir, for how many, see, you have used a real-time data set with the Kaggle, right, sir?
Yes, sir.
For how many real images you have generated synthetic image and used for training?
So, sir, we generated around 500 real images. We used 500 real images and 500 generated images to train our transfer learning models.
In that slide, you told 155 tumorous image and 98
Sir,
non-tumorous image
those
from
are
Kaggle.
the images which have been like we picked up from the Kaggle, but uh, in the in the transfer learning part we used our generated images. That is
Yes, yes,
500
yes.
images.
That's what.
Yes.
Okay. Shanta, madam, any questions? Ma'am?